Well, first, let's talk about what are some other health conditions that could affect it. Let's say you smoke. Let's say you consume alcohol. That, of course, can affect your underlying health and thus can affect your natural smell. What are some other things? Things like, let's say, BV, so bacterial vaginosis. So, BV, it's not considered sexually transmitted. However, when the different bacteria mix within the vaginal canal, that can definitely alter the pH and can cause bacterial vaginosis. It kind of releases this fishy kind of smell. Other things like yeast infection. So, what does that do? A yeast infection actually alters the bacteria that are able to grow, that are part of what's called the normal vaginal flora. So, if you have a yeast infection, it prevents, for instance, certain normal bacteria from being able to grow. Basically, it kind of crowds out the space. If you have a urinary tract infection, if you have a sexually transmitted illness, all of those things could contribute to your overall smell. So, what can you do to prevent this? Well, number one, take care of your hygiene. Make sure that you're laundering your clothes. Make sure you're changing your underwear often. Make sure that at least the genitals are getting washed with at least water. Have a proper diet. Make sure your nutrition is good, your hydration is good, you're limiting your alcohol consumption, not smoking. All of those things are things you can do, as well as making sure that you're getting proper checkups and healthcare screenings. Now, when do you need to do something about it and when do you not? Okay, so let's say you and your partner are engaging in sexual activity and it comes up. There's this kind of smell, and you're not too comfortable with it. You're not okay with it. Well, let me tell you, I would suggest that you absolutely have a conversation. Talk about it. But when do you talk and when do you not talk? All right, let's first talk about when do you not bring it up? During sex itself. That's not the time. So, why? Well, it's going to naturally cause the partner, the other person, to become maybe more self conscious, more self aware. They will kind of emotionally as well as physically and sexually withdraw. And that's not the outcome that you're trying to create here. So, just what I would suggest, I'm not a relationship expert. I do know the science and the medicine, but what I would suggest is have the conversation. Just make sure you're having that conversation at an appropriate time.